Ladies and gentlemen, fellow Rotarians, I'd like to introduce you to our honoured guests, Tony Collier, BEM, marathon runner, friend of Rotary. He's just agreed to be our friend anyway. And he's been brought here by Rotarian Karen Rowe, Paul Harris Fellow, who has done such a lot of work helping Tony to make the borough blue for prostate cancer awareness. Over to you, Tony.
So my story started when I was 45. I was sent for a medical by the firm I worked for, and the outcome of that medical was that I was borderline clinically obese, and that my blood pressure was so high I'd be on drugs the rest of my life if I didn't do something about it. And I guess I should have really got this thing about being a bit overweight, because my kids used to call me Mr. Blobby. And for the young ones in the audience, please Google Mr. Blobby and you'll understand. So I decided to do something about it. I was very sporty. I played table tennis just below county level, and I played social squash. And the gym where I played squash had a little informal running club. And I started running with them when I was 45. And I realised I could keep up, and I actually wasn't bad at this running lark. So 3 years later, when I was 48, we formed Style Running Club. So I was one of the founder members. And then somebody in the club came up with this wonderful idea that because we're now a proper running club, we should all run a marathon. And I said absolutely categorically no. I'm never ever running a marathon, it's far too far. And after about 3 months of nagging, I gave in, and 7 of us entered the Amsterdam Marathon. And one by one, 6 dropped down to the half marathon, leaving Billy Nobates on his own, doing the full marathon. And what was really appalling was after we finished the marathon, everybody got the same t-shirt and the same medal. So there's 7 of us walking around Amsterdam that evening, being congratulated for completing a marathon, and there was only me who'd actually completed the marathon. And I said, never again. And I went on to say never again another 18 times. So I ran 19 marathons between the age of 50 and 59, and I realised I was actually quite good at this. Then I heard about this amazing race in South Africa that became my big bucket list item that I desperately wanted to do. It was an ultra marathon, 56 miles, 6,500 feet of climbing, and because it was in South Africa, it was going to be between 28 and 33 degrees centigrade. And I decided to have a go in 2015. Fortunately, I picked up an injury 7 weeks beforehand, so I knew I wasn't going to finish. But I was running for a local charity, the Children's Adventure Farm Trust, so I went out. I managed 17 miles before I pulled out in screaming agony. And I went back in 2016, I was age 59, and I completed the full 56 miles in 9 hours 46, which was a 4.5-hour marathon, followed by another 4.5-hour marathon, followed by the slowest 10k imaginable as I crawled through the streets of Durban to the finish line in the Kingsmead Cricket Stadium. Then I quite like collecting medals. I'm a bit of a medal, hooker or whore, whatever you want to call it. But I actually enjoy collecting running medals. And so the comrades, if you go 2 alternate years, that 1 year they run from Durban to Pietermaritzburg, and the year they run the opposite direction. And if you do 2 of these back to back, you get a special medal called a back-to-back medal. So I was going back in 2017 to do it again. And I would have been 60 at the time. It was scheduled to be on the 4th of June 2017. And in the February, I ran the Anglesey Half Marathon, and I noticed a little niggling groin strain. And then in the April, I ran the Manchester and Paris Marathons a week apart. And when I got back, I actually couldn't do that motion of getting my leg out of the car. Such was the pain in the groin. And I realised that I wasn't going to do Comrades on the 4th of June if I didn't do something about it. So I made an appointment to see a sports injuries doctor, and we pre-arranged an MRI scan, and that was on the 8th of May. And I could tell by the look on his face that something wasn't right. And he and the radiographer were in and out of each other's offices for about an hour, with looks of great concern on their face. And it was obvious they were talking about me because I was the only person in the waiting room. And he called me into the office and said, Tony, a little bit, we're not seeing what we thought we'd see. They were looking for osteoarthritis. And he said, I need you to go and have a blood test straight away and a chest x-ray while you're here. And tomorrow I've arranged for you to have an emergency full-body CT scan. So you can imagine that night, Monday the 8th of May 2017, was horrendous. Mr. Google did not come up with prostate cancer. Mr. Google probably came up with something like lymphoma, which would have been bad enough, but anyway, there we go. I got a phone call at 8 o'clock on the Tuesday evening, the 9th of May, just as I was leaving my running club, from the sports injuries doctor to say, I'm really sorry, Tony, but I'm 99% certain you've got prostate cancer. And we need you, I'm phoning you to tell you because I need you to have some more tests urgently. So I was sent for biopsies, a bone scan, and further scans of various different parts of the body. And the outcome when we saw the urologist was that the cancer was very advanced. It basically spread into the pelvic bone, and that's why I was having pain. The pelvic bone had fractured because of the running. And it also spread into the hips, ribs, spine, neck and skull at diagnosis. And I was told that I probably only had 2 years to live if things didn't work out according to plan. And that was 4.5 years ago, and I'm still here. To be told you've got cancer is bad enough. To be told that there's no cure for it is utterly indescribable. And our world fell apart. It was just really totally unimaginable. All these sort of thoughts go through your mind about, will I get to walk my daughter down the aisle? Well, actually I did about 2 months ago, which was just incredible and a wonderful experience. At the time I had one grandson who I absolutely doted on. Would I get to see him become a teenager? The reality is that at that time I thought I probably wouldn't. Now I think there's an outside chance that I still might. And that was just horrendous. But the worst part of this story is that because I was diagnosed so late and I had no symptoms whatsoever apart from this groin strain, because I was diagnosed so late, the only treatment available is to remove male hormone. So they take your testosterone away, which effectively means I'm now an honorary woman. And that is awful. It's effectively chemical castration. And just get that through your minds, chemical castration. That's what they did to the guy Turing. So that's basically what I had to face, chemical castration, with all the horrendous side effects, which for me as an athlete and me as a man meant total emasculation. That is the worst case outcome of a late cancer diagnosis when you become incurable. So those side effects were weight gain. So I'm 1.5 stone heavier than I was. Reduced muscle mass, which you can imagine for a runner is pretty horrendous. Reduced bone density. So I'm very liable to break bones more readily than other people. Hot sweats and hot flushes. So I'm now much more empathetic with menopausal ladies than I used to be. And fatigue, which as a runner is actually really difficult because I could go for a run and after a mile realise that today running was not going to happen because I was so fatigued. And I would turn back to base in floods of tears because I couldn't do it because cancer had robbed me of my ability to run. Loss of libido and sexual function. This is worst case scenario. Basically, my oncologist told me that I would never get an erection again, but I probably wouldn't want one because I'd have no libido anyway. So I said to him, have you got any more bad news? He said, yes, you'll experience penile shrinkage. So this was all good news. But we actually cope with that. This affects both parts of a relationship. You can imagine this has affected my wife as much as it's affected me. And it's really, really difficult to cope with. But we joke about it, we try to bring humour into it, and we still have a wonderful, intimate relationship, which is great. As an athlete, I went from being a sub-elite runner to a back-of-the-pack plodder, because that's exactly what I was told would happen, and that's exactly what's happened. I just simply cannot go as far, run as fast, whatever. I then found out that I had the right to a PSA blood test at the age of 50. A PSA blood test is the only way to start the diagnostic process for prostate cancer. There is no other way apart from developing symptoms, and in my case, they think I'd had it for 10 years and I developed no symptoms at all. So clearly the PSA blood test is really important, and men have a right to a PSA blood test at the age of 50, and I didn't know. So I was furious, and I now make it my life work to make sure men know that they need to go to the doctors to ask for a PSA blood test, because we do not screen for prostate cancer in the UK like we do for cervical cancer and breast cancer for women. And my wife asked a urologist at one of our sessions with him, how long do you think Tony's had this cancer? And he said 10 years. I was 60 at diagnosis. If I'd had that PSA blood test every year from 50 onwards, my cancer would have been caught and cured with a much better outcome. I would have been living longer. I wouldn't have all these horrendous side effects because I'd had no symptoms at all. So, awareness raising is really vitally important. And a friend of mine, who I've been trying to get as a client of my accounting practice for many years, said to me, he'd heard my story and he went to his GP and said, can you do me a PSA test? He was 47 years old and your archetypal alpha male, tall, handsome, good-looking, great sportsman. And the doctor said to him, look, you're too young. You've got no symptoms, there's no need. And he said, look, I've heard Tony's story, I want a PSA test. So eventually the doctor caved in, did a PSA blood test, and his PSA was 4.7. For a 47-year-old, it should have been less than 2. The GP then did another PSA test 6 weeks later, and his PSA had risen by 10% in 6 weeks. He went on to have curative treatment. He'd have been dead by 55 if he hadn't done something proactive about his prostate health. That's the power of awareness raising. In my case, I decided there were 2 ways forward. One was to curl up on the sofa and give in and let the cancer take me away. Or I chose to take control. I chose to take control of the cancer rather than being controlled by it. And for me, that meant exercise. Exercise had always been a vital part of my life, and I wanted to carry on exercising. But I also wanted to use my ability to do things to actually help raise money. And because I could still do things, because I'm actually a very lucky man, and that sounds counterintuitive, doesn't it, to say I'm a lucky man with terminal prostate cancer. The reality is that I've actually responded really well to treatment. I'm doing remarkably well. I'm 4.5 years post-diagnosis and my cancer is still completely stable. And lots of men who are diagnosed at the same time as me are dead already. So I'm very lucky. And I realise I'm lucky and I'm going to use that luck to keep spreading awareness, but also to raise money for prostate cancer, because this is really important. If money is raised for prostate cancer, it will help us to get a proper diagnostic test that we don't currently have. It will help to develop new treatments that will extend my life, that might enable me to see my grandchildren become teenagers. And that to me is really important. So I've done some really mad things since I was diagnosed. Some people think that these are things that normal people wouldn't try. I've qualified for the London Marathon before my diagnosis with a good for age time for an over 60. So I decided I was going to take the place, because you don't actually give up a place in London very often. And it was the hottest London Marathon on record. I knew it was going to be my worst ever marathon, and it was. I ran in 5 hours and 7, and I raised £13,000 for prostate cancer, and it's something I'm incredibly proud of. Of all the 20 marathons I did, that's the one I'm most proud of, because it was really an adversity. 2019, I decided I was going to try to run 970 miles in the year. And I could hear you all thinking, why 970? Surely 1,000 would make more sense. At the start of that year, 970 men died of prostate cancer every month in the UK. During the course of the year, that rose to 1,000. And I wanted to run 1 mile for each man that was going to die every month in the UK. 2020, COVID hit, and my mental health took a bit of a battery because I couldn't see my grandchildren who I absolutely dote on. So I decided in May of 2020 to try to run at least 5k every day in May. May became June, June became July, and eventually we were approaching a year. And I decided to call it a day because it was getting a bit obsessive. And on the 9th of May, my cancerversary, I decided to stop this streak. 374 days at 1,546 miles. This year alone, I've done the Macmillan Mighty Hike, a marathon around Ullswater. I've done Prostate Cancer UK March for Men with Jeff Stelling, the football guy. And I've climbed Scarfell with 2 other terminally ill men. But in addition to that, I've also completed a 100-kilometre ultramarathon. 100 kilometres is 62 miles. Did it over 2 days. And this year alone, I've raised £11,000. And over the last 3 years of fundraising, I've raised nearly £45,000, as well as encouraging other men to raise money for prostate cancer by doing things, because They've heard my story and they know how much fundraising means to me. And I mentioned the Man of Men badge. That starts conversations. If you get one of those Man of Men badges and wear it on your lapel, and so people say, what's that all about? Tell them my story. The summary of my story is that if you get an early PSA test, you get early diagnosis, you get curative treatment with much better outcomes. If it's left too late, you end up like me, with cancer from here to here, and a terminal diagnosis with a prognosis, worst case, of 2 years. So the challenge really is, what can we all do to help? And I want to do a little bit of a technical thing about prostate cancer, because I think it's important that we know a little bit more about what the prostate does. And you can see I brought some bits and pieces with me. A conker, a walnut, a lemon, an orange, and a melon. Would anybody like to give me an idea of which of those they think the prostate resembles most in terms of size? Walnut. Absolutely correct. The normal size of a prostate is the size of a walnut. Someone with a prostate that's not doing very well is the size of a grapefruit, potentially. Now think of this as a prostate. The urethra that carries urine from the bladder to the penis runs through the middle of it. If it's that size, there's no pressure on the urethra. If it's that size, you're going to have trouble peeing. And that basically is the standard symptom of prostate cancer, is pee-orientated problems. But I've also heard of people being diagnosed with prostate cancer because they had blood in the urine or blood in the semen. And one friend of mine said he was having sex with his wife and he reached orgasm and didn't ejaculate, and that was a giveaway. So what does the prostate do? Where is it? The prostate basically sits below the bladder, leads to the penis, and its job is to help make the fluid that creates semen. It's as simple as that. Lots of things can go wrong with it. Most of those things are things like infections, enlarged prostate. It gets bigger as we get older. It might not get that big, probably that big really as you get older. But it does get bigger as you get older, so inevitably it will start to cause some problems because it will put pressure on the urethra. And so as time goes by, the prostate gets bigger, it causes problems, you get infection, but worst case scenario, you get prostate cancer. It affects so many people. 1 in 8 men in their lifetime will get prostate cancer. It's 1 in 4 for black men, and we have absolutely no idea why. If your father or brother has had prostate cancer, you are 2.5 times at greater risk. If your sister or mother has had breast cancer before the age of 60, you are at greater risk. My sister died of breast cancer at the age of 53, and my mother had breast cancer but survived. There is clearly some hereditary link going on there. We have no idea what, because we've been tested for all the appropriate genetic defects. It is a disease that affects older men more. Men generally over 50 are at greater risk, but this is not just an old man's disease. We had an ambassador for Prostate Cancer UK, Lloyd Pinder, who was 44 years old when he was diagnosed, and he died last year aged 49 with 2 young children. This is not just an old man's disease, it's affecting more and more people. The one thing that I really want to get the message over is that men have a right to a PSA blood test at age 50, but you will not get one unless you go to a GP to ask for it. If you go to a GP and the GP says, like they did to my friend, you've got no symptoms and you're too young, tell them my story. If you're over 50, you have a right to it. If you're over 45 with a family history, you should insist upon it. If you're over 45 and you're black, you should insist upon it. Because the PSA test is the only way to start the diagnostic process. And that's a really, really important message. Prostate Cancer UK have on their website a 30-second risk checker. Go to Prostate Cancer UK website, in the search box, put risk checker, and it will come up with 3 questions that will tell you what your risk of prostate cancer is. And it will depend on your age and ethnicity. So, if nothing else, go and do the risk checker. But for all men, you need to be thinking about that PSA blood test. If I'd known about it when I was 50, if I'd had a PSA blood test every year, my cancer would have been caught early and I would have been cured. That would have been a much better outcome. I wouldn't necessarily live in with all those horrendous side effects I talked about. And that is the clear message I want to get across. Be proactive about prostate health. That's my story. Thank you.
Just a quick one from the female audience is, I don't know what age we are when we get the call up letter from our doctors for smear tests, which they then do every 3 to 5 years. And then when we hit the magic 50, we then have the breast screening. Now I know that I'm old enough to have had all of those, and if you don't, you get bombarded from the NHS to do it. Is it what you're saying is for men they don't bother?
Yeah, the easy answer is that we do not screen for prostate cancer in the UK. The reason for that is the PSA blood test is not a diagnostic test. It's simply an indicator tool. It misses 15% of prostate cancers, it misses 2% of aggressive prostate cancers, and historically it led potentially to over-treatment. So if you went for a PSA blood test and you had a raised PSA, in the old days that went straight to biopsy, and it was always transanally, transrectal. That led to sepsis, led to infections. It was not very nice. But the diagnostic pathway has now changed that level of recognition. So we now do them very differently. We will not do biopsy in general, but there is a bit of a postcode lottery. We will not do biopsies without doing a multiparametric MRI scan first. That tells the doctors, the health team, where the tumours might be in the prostate, and then they go in and actually do appropriate biopsies rather than scattergun, and they do them transperineally rather than transrectally. That's massively reduced risk, it's massively reduced over-treatment, and it makes the PSA blood test much more appropriate than it used to be. And we are now working very hard to make sure that GPs are as up to date as possible with the new diagnostic pathway, and in particular the use of MRI scans in the diagnostic process, because that's really, really important.